week that I am recording. This is the nursing process in drug therapy and patient safety. So we as nurses definitely need to understand that we are dealing with a population of patients that are not only suffering from more chronic illnesses, but now because of changes in healthcare, more people have access to healthcare, which is a great thing. We'd love that. But that also means that we're treating patients that are suffering with a higher acuity of some of these chronic and acute issues. So in turn, that means for us as nurses that this is going to increase the amount of responsibilities that we have. Okay. We also have to remember that nurses act very differently in their practice when compared to doctors because we treat patients holistically. Instead of just looking at that medical aspect, we are looking at the mental aspect, cultural, physical. We're looking at all aspects of patient care. We also need to understand that we are a key member in that healthcare team. Your physicians will come to the floor in the morning. They'll spend about 15 or 20 minutes with your patients. They'll go off for the day. You are the person that is with that patient for that 8 or 12-hour shift. You're the one who's looking in on that patient every hour, administering medications, doing physical assessments, monitoring them to make sure that they're stable. As a nurse, we are going to take a lot of different components of knowledge. So you're going to have some of your basic sciences, definitely some social sciences, and we're going to put that all together, and you will be able to be an entry-level nurse when you graduate this program. And the other thing that we need to know is how to apply the nursing process. So we talked a little bit about this last week. I know you didn't learn it yet in your fundamental course, but this nursing process is a systematic way for you to be able to recognize cues in your patients, prioritize things that you would want to focus on, and then be able to come up with interventions so we can try to fix what we're seeing, but also understand and have a good understanding of what we need to prevent. So let's take a look at that nursing process. So nursing process starts with our assessment. So that is you getting assignments on your patients, going in, meeting your patients, and doing that very detailed head-to-toe physical assessment. During this process, you're going to gather some data by talking to your patients, by talking to family members, by reviewing the charts, and then also getting that key information that you were able to identify from that head-to-toe physical assessment. From all that information that you get, you're going to sit down, look at all this information, and then draw some type of a conclusion. So what we want to know is we want to identify any actual problems that we see at this time that we know we have to take care of, but we also want to make a list of problems that we know this patient could potentially develop. Okay, so we talked about this also last week. So your patient may come in, they may have pneumonia. When you walk in the room, you may hear audible wheezing coming from your patient because they're having a gas exchange issue. You may use your stethoscope to listen to them. You may be able to identify adventitious lung sounds. We might hear some crackles and some wheezes in there. So that would be an example of an actual problem that we would have to want to create an intervention for to be able to take care of. But also having an understanding when a patient is sick and they come into the hospital and they're not moving like they normally would at home, this slows their cardiac output and causes some pulling of that circulating blood in your lower extremities, and it leaves them at risk for developing a blood clot. So this is an example of a problem that this patient does not yet have, but given the information and the education that we have, this is now a problem that we have to potentially watch for and try and prevent in our patients. So we need to come up with interventions to keep that patient from developing a blood clot. So after we assess, after we develop all of our nursing problems, then we're going to formulate a long list of interventions for our actual problems and our potential problems. And then we have to go back after we implement those interventions to determine, did this work? Were we able to prevent this? Do we need to change our plan of action? Do we need to incorporate a different intervention, extend that intervention, or, is this a problem that we can kind of like retire and now put on the back burner because we're not worried about this at the present time? So let's take a deeper dive into this assessment. So what assessment information are we looking for? So when we're talking to our patients, we definitely want to get some good information about their past medical history. So what type of other chronic conditions do they have? We want to talk about any other type of chronic conditions they have and know how they're handling it at home. Do they take any medications on a regular basis? Prescription medications, and then those over-the-counter medications as well. Do they have a history of any allergies? If we have to give them a medication, we need to know if they have any allergies. But before we can, we talked a lot about educating our patients and how important that's going to be. But I want you guys to know this, that before we can educate our patients, we have to really talk with them and figure out what is their level of education and what is their level of understanding. If we don't first assess that, we might not be able to educate our patients and have it be as effective as we want it to. We really need to know where they're coming from, and we kind of have to meet them on that education level so that we can tailor things to their learning needs. We also want to know about their social and financial supports. A lot of the patients that you see that will come in will be older, or they may have other people who are taking care of them. So if we want education to be successful and we know that this patient has other support systems at home, we might want them to come in so we can educate them as well. If our patients can't afford the medication that we're sending them home on, that's going to be a problem. We're thinking about a compliance issue and them not maybe being able to take this medication on the long term. So we want to be able to identify what those barriers are before we send them home. And we also want to know any type of pattern of what that past healthcare looked like. So have they suffered from chronic health conditions in the past, and once they go home, they really aren't good about managing their healthcare, and then they end up with these exacerbations in the hospital again. These are things that we need to know because we want to be able to change that trajectory of them being able to manage their healthcare when they go home. So we need to find out what those barriers are. So what are some of those important things we want to look at when we're doing a physical assessment? So we talked about a lot of our medications are weight-based, so we definitely want to have a good reliable weight for this patient when they come in. We definitely want to know their age because we talked last week about how definitely our differences in age on our young population and our older population. We're worried about some interactions with medication. So we need to be able to know how old our patient is and any type of abnormalities that we should be aware of. And then we want to know if there's any physical parameter related to their disease and any potential drug effects. So when we go into our implementation process, this is where we're going to get all of that information that we took through their past medical history and that physical assessment, and we're going to synthesize all that information into creating what we call nursing problems, or you may see it still used in other resources as a nursing diagnosis to be able to plan patient care. We're going to be able to set realistic goals for these patients, and then we're going to go back and evaluate those patient outcomes to determine, did they have an effective response to that drug therapy that we implemented? Did they have a lot of adverse effects? Do we have to discontinue this medication, start a new medication? And do our patients have a good understanding of their drug regimen? So there are 3 types of nursing interventions that we commonly think of when we think about medications and pharmacology. So definitely drug administration. So do we have any allergies? What type of, how do our patients take our medications? How do they take them? So for instance, if you have a patient that's taking an oral medication, what is one of the first things that you think we're going to want to assess about our patient before we administer an oral medication? So really, the first thing we want to think about is our patient's ability to swallow. If we're giving an oral medication, we have to make sure that our patients are protecting their airway and that there's no reason why they can't take an oral medication. So that's the first thing that you guys want to know. Then we want to know, are there any things that we need to think about with regards to comfort measures? So is this a type of medication that we know is a heavy hitter on the GI system? Then maybe we want to educate them about taking it with food. Is this a medication that chronically causes diarrhea. Again, maybe we want to give them medications to try and prevent diarrhea. And is there any very important patient or family education that we should be talking to about our patients? Definitely thinking about proper drug administration, right? You guys need to know the 6 rights of the proper drug administration. This is definitely going to be on your exam. So this is the right person. This is the right drug or the medication. This is the right dosage. This is the right route. So are we giving it PO by mouth? Are we giving it IM intramuscularly? Are we giving it IV intravenously? Timing. How often is this medication ordered? Is it ordered every 8 hours? If so, when was the last time it was given? Is it within that 8 hours? And then, of course, the right documentation. And the right documentation happens when you scan your patient and you scan your medication, and then you hit save. It usually documents it in your electronic medical administration record. Comfort measures. So what are some examples of some comfort measures? Definitely being able to help that patient cope with the effects of drug therapy. So we talked a lot about how we really want patients to be compliant, right? So we know that as nurses, one of the best ways that we can increase compliance is to educate our patients about the side effects. If they know about potential side effects that will subside, then they're more likely to continue that regimen of medication. So if they're having GI upset and nausea every time they take this medication, maybe they can take it with food or with milk, something that'll ease those GI side effects. We spend a lot of time with these patients, like I said, 8 to 12 hours a day in a hospital shift. So we're in a unique position to be able to check in with them, follow up with them, see how they're tolerating their medication, and come up with implementations to keep them comfortable. We want to be able to promote drug therapy. So we want to make sure that we're managing adverse side effects, of course, and talking about any lifestyle adjustments. So a good example of a lifestyle adjustment with some medications are your diabetes patients. So to think of a patient who was just diagnosed with diabetes, maybe they have to take insulin on an everyday basis, they are going to have to experience a huge lifestyle adjustment. They're going to have to monitor their blood sugar every single day, multiple times a day. They're going to have to change their diet. They're going to have to increase their exercise activity. There's a lot of things that go into a lifestyle adjustment that could be very difficult for some patients. So we do have to be aware of that. Patient and family education, like I've said, very, very important. Definitely talking to those patients, letting them know potential side effects, when to call the doctor, what are some side effects that will go away within a couple weeks. And if you're thinking of that you're caring for patients that have care providers or family members that are actively involved in the care of these patients, we need to educate those people as well, because we want to make sure that this patient is compliant with taking those medications. So what are some elements of patient teaching? You definitely need to know this for your exam. This is going to be on your exam. So what do we do first before we educate a patient? We need to assess their education level. We need to be able to meet them where they are and make sure that they understand what we're talking about. If you're educating a doctor, you may be able to use all your nursing words with them because it's terminology that they're familiar with, okay? If you're educating someone who never worked in the medication field, that maybe only went to high school and graduated 12th grade, they might not have the same understanding, okay? So we need to find out, how do they learn? What is the best way they learn? Is it visual? Is it hands-on? We want to just make sure that they're compliant, so we want to meet them where they are. We want to make sure that we are properly explaining the name of the medication, the dose that they're to administer, and how that medication works. Because if they understand how it works, then they can understand why it's important for them to be able to monitor their blood pressure at home and things like that. As an example, we want them to understand clearly the timing of administration. Mrs. Jones, you're going to take this medication 3 times a day, once with breakfast, once with lunch, once with dinner. We want to make sure that we go over any specific special storage or preparations about this medication? Does it have to be stored in a refrigerator? Does it have to be kept out of the sunlight? Definitely really talking to them about not combining prescription medications with over-the-counter medications. So we want to talk with them again and say, listen, do you take anything over the counter that isn't prescribed to you? Because these medications can really interfere with any prescription medications and have adverse side effects sometimes. Any type of special safety or comfort measure. So we talk a lot about blood pressure medications, right? If we give a patient a blood pressure medication and they change positions quickly, it can cause them to feel dizzy, and it can cause them to lose their balance or to even pass out. So we talk to them a lot about changing positions slowly when you first start this medication, sitting in the side of the bed or the couch and sitting there for a couple minutes, dangling their feet, making sure that they don't feel dizzy before they stand up. We want to talk about specific points about drug toxicity, if there are any, and some of those warnings about, hey, if this happens, then this would be a reason for you to discontinue that medication. Or, hey, if this happens, we really want you to call into the office, and we can definitely educate you more about what we should do moving forward. And then, of course, we want to make sure that we evaluate. So evaluation is the part of the nursing process that is going to be continuing, right? This is going to continue over and over with regards to patient care. This leads to changes in our assessment, changes in our nursing, identifying nursing problems, and it leads to changes in our interventions. Also, as part of being a nurse, a big part of our job is preventing medication errors. We are the people who are the nurses. We are the staff that is with our patients that are administering medications throughout the day. So that puts us in that ever so important role to be able to prevent them as well. So we have to be, we have to make sure that we have a good understanding of how medications work. We have to make sure that this medication is right for our patients. We have to make sure that we're using all of those systems and checks that we've talked about over the last 2 weeks to make sure that we prevent errors. And then we also have an obligation to report medication errors. So we've talked a lot about this, about accountability, and accountability is so important in nursing, because do we want you to give a medication by mistake or make a medication error? No, we do not. Is this something that we take very seriously? Yes, it is. Could you potentially make a medication error? You could. We have a lot of things in place to prevent this. We're educating you about the importance of preventing medication errors and some things that you can do and implement into your practice to prevent them. But at the end of the day, we are humans, and sometimes humans unintentionally make mistakes. So what happens if you administer a medication, the wrong dose or the right time or the wrong medication? You have to be accountable, and you have to be able to then go to your charge nurse or go to the doctor or go to the pharmacy and say, look, Mrs. Jones was supposed to have 50 milligrams of metoprolol. Instead of me cutting the pill in half, I gave the whole thing. Okay, so you need to be accountable. You need to report it, and then you need to make sure that you are prioritizing the patient's safety. All right, so who is responsible for medication administration? Definitely the prescriber who orders the drug, the pharmacist who dispenses the drug, and the nurse who administers the drug. So let's answer a couple questions. A patient reports that she has a drug allergy. In exploring the allergic reaction with the patient, which of the following might indicate an allergic response? A, increased urination, B, dry mouth, C, rash, or D, drowsiness? So the answer here is going to be C, rash. If we look at answers A, B, and C, these are going to be types of intended effects that we will see sometimes with medications, depending on what medication we are giving. Some medications caused increased urination. It could be an intended effect or a side effect, but not necessarily an allergic response. Same thing with your dry mouth and drowsiness. But a rash, we would never give anyone a medication to intentionally cause a rash. So this is going to be your allergic response. Another thing I want you guys to think about, if your patient says to you, and this is important, you definitely need to know this for your exam, you're going to see a lot of patients that'll say, oh, I can't take that medication. I have an allergic reaction to that. Okay. we want to know what that reaction is, right? That should be our first question. Once they tell you they have an allergic response, we should say, tell me what happens when you take that medication. They might say, my throat closed up and I stopped breathing. That is definitely an allergic reaction. Or they might say, oh, I took it and on day 5 of taking it, I got diarrhea. Well, diarrhea is not a reaction. Diarrhea is a side effect of a medication, okay? Definitely not an allergy. So you guys know when you see a patient and they say, oh, I have an allergic reaction, your first go-to is tell me more about that. Tell me what happens to you when you take this medication. All right, next question. The nurse writes a nursing diagnosis for which reason? So nursing diagnosis is also going to be what we call now a nursing problem. So we don't really, in this program here, we don't talk about nursing diagnoses anymore. We've moved to where we're talking about nursing problems. So nursing diagnosis and nursing problem are the same thing. So why, as nurses, do we identify actual or potential nursing problems? That's what this question is asking you. Is it A, to direct medical care? Is it B, to help to increase patient compliance? Is it C, identify actual or potential alterations in patient function? Or is it D, to determine insurance reimbursement in most cases? So the first thing you need to understand is that creating a nursing problem is only done by nurses. No one else does this. Your physicians don't do this. Your nursing techs don't do this. Only nurses do this. So this is something that is very unique to our practice. So the answer here is C. We do this because we want to identify actual or potential changes in the function of our patients. Next question. The evaluation step of the nursing process is A, often used as a last resort. B, is important primarily in the acute setting. C, is a continuous process. Or D, includes making nursing diagnoses or nursing problems. So again, this is going to be C. Your evaluation is a continual process. We will continue to do this for as long as we are taking care of our patients. And our last question. A nurse obtains a medical history from a patient before beginning drug therapy based on an understanding of which of the following? A, medical conditions can alter a drug's pharmacokinetics and pharmacodynamics. B, a medical history is a key component of any nursing protocol. C, is a baseline of information necessary to evaluate a drug's effect. Or D, the medical history is the first step in the nursing process. What do you guys think? So your answer here is going to be C, a baseline of information necessary to evaluate drugs' effects. All right, chapter 6, we are going to talk about challenges to effective drug therapy. All right, changes in healthcare in the 21st century. So what are some major changes that we are seeing that is now affecting our practice? So access to medical and pharmacological information is available from so many different resources, right? Facebook, any type of social media, TikTok, Instagram, you know, definitely those social media accounts, definitely a lot of online accounts. The things that we need to understand about this is that our patients out there have access to this. So this means that us as providers, we need to make sure that we are staying up to date with that scholarly information as well, because they're going to have access to stuff and ask us questions. Consumers are now taking steps to kind of guide their own medical treatment with certain things. They diagnose themselves online and they find different treatments or options, and they come into the office and say, hey, look, I heard about this. Do you offer this? There's definitely a lot of alternative therapies out there as well. Some are great for our patients, some are not, but patients do have access to this, and they're probably going to ask us about these things. There's also a lot of financial pressures that are leading to early discharge. We've talked about this already. We plan discharge as soon as the patient is admitted. Even if they're going to be in the hospital 8 to 10 days, we are planning discharge from the minute they come in. And then, of course, we know because we have financial early discharges, we are doing a lot of patient teaching and setting up a lot of home care opportunities for our patients once they're discharged. All right, so what are some of those federal guidelines that we see that are in place with regards to drug advertisement? So you will see that when there are different commercials and things like that for medications, that they have to follow certain rules. So when an advertisement comes on, they have to make sure that they state what this medication is intended for. If it's a GLP-1, then it is indicated for managing type 2 diabetes, okay? It also has to include any contraindications to why a person may not be able to take this medication. It has to list all of the major adverse effects that could be experienced when taking this medication and any important precautions that the patient would want to follow. Again, we've talked a lot about different internet resources for drug information. Definitely where you work is probably going to have a good, valuable resource for you to use. There's a lot of online pharmacies. There's a lot of different government agencies that you can use. There's also a lot of sites that probably aren't monitored as well, that probably should not be our go-to. So sticking to those, evidence-based sites. So anything that ends in ORG, anything that ends in GOV, any of your drug guidebooks that have been recommended to you from the program and things like that are going to be your best places to be able to find that. Same thing with your internet resource. There's just so many options out there for our patients today that we just need to make sure that when we ourselves are giving information to our patients, like, hey, you can go to this site and look up and find information about this when you go home. We just want to make sure that basically that those sites are reputable. So we want to know who reviews these sites, what are their qualifications, are they scholarly, are they peer reviewed. We also want to make sure that we are only telling people about sites that are updated frequently. If you recommend them a place that hasn't been updated since 2019, it probably doesn't have the latest, greatest information on that. So we need to be careful about that. And then accuracy and reliability. I wouldn't say that a lot of the information that we find on TikTok and Instagram and Facebook is always accurate and reliable. I'm not saying that there is not some that could be, but I feel like the majority of that don't even require for you to have an education in the medical field for some people, for them to be able to create sites that give medical information and medical advice. So alternative therapy, we've talked a lot about this. So we've talked about how it definitely increases the risk of adverse effects in our patients. So what are, just a little detailed look about what are some of those drawbacks to alternative therapy. So when you think about something that's over the counter, we have to understand that the FDA has not done any type of testing in these active ingredients. Okay, so we don't know a lot of the side effects. We don't know how it's going to affect people. There could be also incidental ingredients that are put into these products that no one's ever tested, that we don't know about, and we don't know what the adverse effect is going to be on your patients. We do have to understand that patients really don't mention these to providers sometimes because they think they're safe because they can buy them over the counter. Okay. And then, of course, we know that drug alternative therapy is going to cause interactions, and it's important that we talk to our patients about these. So what are some controls for alternative therapies? A lot of our herbal medications are not controlled or tested by the FDA. Advertisement for these medications is not restricted because they're considered dietary supplements. So that's how they get around it. And there's no regulation for these in any type of industry, which means that they can cause harm. You definitely will see in the nursing field as you start giving medications that there are a lot of medications that are prescribed for off-label use. We call these off-label medications. So this is the use of a drug for an indication that was not originally approved by the FDA. So what are some examples of that? So originally when Zepbound, a GLP-1, was developed, it was developed to control type 1 diabetes. And it does this by causing weight loss, but it wasn't approved for weight loss. You had to have type 2 diabetes. Now we are able to use this medication for weight loss in people that don't have type 2 diabetes. Ativan is another medication that we give. It's usually an antipsychotic medication used for anxiety, but this also is used in our cancer population to decrease nausea. So again, off-label use. So the occurrence, this is commonly done in groups of patients for where there is little pre-marketing testing, and it's used with pediatric and geriatric population. And another thing just to keep in mind, because this is definitely barriers to being able to provide care to some patients, is that, you know, we're living in a time now where healthcare is somewhat more affordable and attainable to people, but still these medical cares and medications that we prescribe are very, very expensive and unattainable to some. There's a lot of research and equipment that's required to be able to meet consumer demands. This also increases the prices that we see. And again, we're seeing earlier discharge from hospitals, which means that patients are being discharged sometimes when they probably shouldn't be, and then they're at a risk for being readmitted again. So these are just some of the things that you're going to see when you're providing healthcare services to your patients in the hospital setting.